1, and we made sure that we were going to be here for an hour. So in doing so, I want to make sure I introduce some people here and just let you all know why we're here tonight. So my name is Michelle Casadiola. I'm the superintendent here in Hale and Roslyn. We have Dr. Larson here tonight with us. Gar Hill is our school board chair, and Susan Miller sits on our school board. You'll notice that we have 2 school board members, but this is not a school board meeting. This is just 2 members of our school board that are here to help listen and learn from our community, because we know that we have lots of questions that are circulating and concerns in our community. So in order to have our voices all heard tonight and everyone have an opportunity to speak and share what's on your mind with us tonight, there's a couple things that we ask. One is that if you have a softer voice and it's hard to project, to come on up here, and I'll keep the microphone here so you can just lean in. My job is not to answer all of your questions, but to listen, because it's a listening session tonight. If you do have a question I can't answer, I'd be happy to do that. Same with our board chair and Susan Miller and Dr. Larson. I will also be taking notes so that we make sure that if you do have questions and we don't have the answers, and there will be plenty of them, that we make sure we get questions answered for you. So again, thank you so much for being here. And anything anybody wants to say up there? Okay, so we have 2 mics set up for them, so if you are asking them a direct question, they can, and they can answer it, they'll be able to use the mic. So here we are, and we're here to listen. Anyone want to come up?
It doesn't matter what I feel about mask mandates, but I have no control over that issue. There has not been any talk, when I've been the health officer here in Kitsap County since 2006. There's not been any talk about mandating COVID vaccine for kids yet, but if that process goes through, similar to measles, mumps, rubella vaccine or something else, that has to go from the governor to the State Board of Health, that's today, then it has to go through a whole bunch of processes. And if that was to happen, I wouldn't expect that to happen before next year, so next summer, and then there's a whole process that has to go through. I'm not sure that that they will be mandating that, but if they do, they follow the process that they do with tetanus, pertussis, measles, mumps.
Right. So my question was, will you personally, each one of you, follow through on that? If it's mandated, will you enforce it? Will you enforce it? And I don't know what your ability is to enforce these, but if it's governed by law, and there's a mandate that says, yes, this is enforceable by law, will each of you personally enforce it? Not whether it's legal or not. My question is, will you enforce it?
If it's governed by law and it is the approved vaccine, just like measles, mumps, rubella, we will follow that. I will follow that law just like I would. I have patients that say I want a waiver for MMR vaccine, or I want a waiver for pertussis. But I'm responsible for upholding the law, so I would enforce that. And if you said, I don't want to do it for my kids, then you'd have to go to a physician and get a waiver.
Could you answer that?
If it's the law, we have to follow the law.
So sometimes what's right and moral, what's lawful and what's moral are sometimes 2 different things. So where do you stand with that, as far as giving a parent the ability to make choices for their own kid? Will you do what the law requires, or will you give parents the right? I see a lot of people here without masks, and that kind of tells me something about their belief in freedom. I see all of you with masks. That also tells me that you're rule followers, and that's your job. You don't want to risk it. But I'm kind of at the point now of thinking, maybe we need to risk our jobs and not worry about a paycheck in this point. So are any of you willing to risk your jobs not following the rules? Because I just got an email 10 minutes ago saying I have to get a vaccine. And I will not get a vaccine. I am not putting that on my body. I have a kid on the way. I just moved here a year ago. And I'm willing to lose my job. I've been caring for COVID patients for a year with an N95 mask. So are any of you personally, on a personal level, willing to lose your jobs?
I risk my job every single day.
So do I. Or are you willing to risk your job for breaking the rules for the kids?
To do what's right.
That's your interpretation. So
That's
do I have
just like-
opportunity
just like
to do what's right for my kid?
Just like it's yours.
But we don't.
Okay.
You're saying that we won't.
You won't what?
If they approve of vaccine for children in school, then you'll follow that rule, but we won't have the choice. We'll have to withdraw or go get an exemption.
You have a choice.
We have a choice.
Doesn't sound like
It doesn't sound like it. Okay.
The Secretary of Education, Miguel Cardona, has already announced that he plans on getting as many children vaccinated as possible, and they plan on putting up vaccination stations in our schools. He announced this, so why wouldn't you guys know this information?
David?
I haven't seen anything.
So we've done vaccination clinics in schools for a long time. So 3 years ago, we did a flu vaccination clinic at Ellensburg High School. So that's not outside of what we've done in the past. We gave COVID vaccination here at the high school for those kids 12 to 17, 12 to 18 that was available for them.
And I think one thing that we don't trust is our kids coming to this school and coming home vaccinated without us even knowing.
Yeah, there's not any truth in that. That would
There's
not happen.
absolute truth in that. That is not true. Or 13 years old, schools are now legally allowed to tell a 13-year-old, hey, you do not have to tell your parents.
Not in
That is
Washington.
not
Not in
true.
Washington.
That is not true.
Not in Washington.
Hey, Michelle.
Yes.
Can we use
Yes.
the microphones? People are
Yep,
talking away
so,
from
and
us.
we also want to
Let's
make,
hear it.
we already heard back here, yeah. So thank you for that.
Thank
We
you.
also want to make sure everyone has an opportunity to ask a question. So if somebody else has a question, it's easier to use the microphone, or have you hand over the microphone, or pop up here to the podium.
Good evening, John Biter is my name, and I'm wearing a mask tonight out of respect for you guys, because you asked us to. I hate the mask. I have to wear it at work, in some portions of my work, no risk of my doing. So, there's a balance, you have to make your choices. In regards to the kids, for the mask mandate this fall, is it going to include the sports activities? Because seeing my daughter running around playing soccer, doing this so she can breathe, you were at that game, it's over the top, that kind of thing. She's out on the soccer field. The risk of her getting COVID on the soccer field is minus 100,000. And so that's the first part of my question. Is that
I can answer that. So right now, WIAA has not set forth what the fall looks like. I do know there's differences in outdoor seating versus indoor seating, which is why masks are required here, because we have students present in normal school. So thank you for respecting that. But for sports, I'm not sure exactly what that looks like. As soon as we get information, I know Dr. Larson might have some information on sports that he could address that isn't public for the superintendent's yet.
Yeah, thanks for asking that question. So it appears, so Bob Letts is the health officer that kind of is working with the state and with sports folks and coming up with some guidelines. So last year, as you well know, wrestlers had to be tested, right? We did some testing of kids here. It looks to me like, and you don't hold me to this, as far as I know today, that outdoor sports will not have to be wearing masks. But indoor sports like wrestling might, and that's as much as I know currently. I would expect something in 2 weeks.
Okay. Cool. Well, thank you for that part. In terms of the masks in the classroom, my preference is not, and I think that the state is over the top in mandating. I think the parents should be able to make that choice, as with the vaccines as well. And if you think your kid needs to wear a mask, then your kid should be wearing a mask, but that doesn't mean my kid should be wearing a mask. So I hope that you'll just hear that and take that and feed it up the food chain to the state level. that, from my point of view, the state shouldn't be micromanaging us in that way.
Hello, my name is Karen Loftus. I'm a retired RN, and I wanted to ask Dr. Larson, would you give a child a waiver as a conscientious objector?
No.
I don't think, the incidence of children dying from COVID is so low in the whole world. I don't see why children have to wear masks in the schools.
I'm Mary Fauché. I have a granddaughter that goes to school here, maybe. I have a question, and I'm sorry if it offends anybody, but I want to know, what in the world are we doing in our state if our border is not closed and 18% of the children coming across the border today are testing positive? What are we doing? Our borders for the state of Washington should be closed. And I know you guys have nothing to do with that. But my concern is, this mask protects me if I don't want to breathe what you're doing. Exactly. But if I feel in our schools that our teachers, our adults, anybody, a child, anybody that feels safe with a mask on should wear one. But I do not feel that people that are building their immune system by exercising, eating right, going out in the fresh air, you also build your immunity, do you not, Dr. Larson, by being around dirt and being around things that your body can build from? And I just don't know what we're doing to our children. But if our border is not closed and we have COVID pouring over and those people are not coming across with a mask on, why are we asked? Yeah. And I think, I do. I think Governor Inslee is an idiot. Yeah. I have to say it. I grew up in Yakima. Jay Inslee was an attorney in Yakima, and he was run out of Yakima by the Lawyers Bar Association, and it is fact, okay? I am not claiming him to be an idiot with no basis, okay? I'm a grandmother, and right now, I don't think Penelope's going to start school. Because I can take her to places and have her be healthy until we figure this out. And I want to bring her here. I want to come and I want to help in the classes. And I'm vaccinated. I drank the Kool-Aid and I'm fine with it. But I want our schools to be strong, but I want our schools and our state and our federal government to hear the people.
My first question is, I know a lot of this is out of your control, and I acknowledge that. My first question is, if it was put in the school's hands, would you guys support parent choice? Because it would ultimately come down to your control. Sorry. If it came down to the schools, would the people that are here in charge of our school support parent choice? Can you commit to parent choice?
So the first thing that our school board did last spring was to make an announcement based on all the information we had at the time that our desire is to have students come back without masks. Our numbers were really good, vaccination was increasing, hospitalization was down, and that was our intent. And the Delta variant started picking up again. And so
everybody, but I want to know if the school board has our back if it came back at work.
You can't hear her up here.
Sorry.
You take your mask off?
No. I'm sorry. I can't.
We can't hear you because you're muffled with the mask on, even with the mic.
We're 6 feet away. Take the mask off.
You know,
So, I'm sorry, you're actually speaking over me, so if you would give me an opportunity to talk. Last year, at the end of the school year, our school board made a public statement that they were very much in favor of having our students come back unmasked. And that was the last time we had the discussion about it, and then the governor put down the mandate that masks are a requirement for all public schools. That's a mandate. That's not a discussion at this point. It's a mandate.
So that was one question. So if it did come back in our hands, we have the school board support for parent choice. If the mandate was lifted. I'm asking our board members.
For whether you want your child to come unmasked or not?
Yeah, do you support parent choice as a board member?
If you want, if they lift the mask mandate, and as a board, we would seem to allow that. We wanted them to come back unmasked to begin with.
Okay, thank you.
We'll cross that bridge when we get there.
Agreed.
But then that is your personal choice.
Okay, thank you for answering my question. My other question is, in your email that you sent out, you said part of this is listening, learning, and then coming together as a community so that we can give feedback. What impact or how do we impact a change?
I think your question is excellent. I know many people are upset about the mask mandate. It is a mandate, and we are bound legally to uphold the mandate. My question is, as a community, those of you who are adamantly opposed to it, what outreach has happened with the governor's office? What communication? And I think that's where the voices need to be heard, is at the governor's office. That's who's making the mandates. We're not making the mandates, we're just enforcing the mandates. Legally, we were held to that. So I think that would be a good start.
So that is happening, daily, and it's falling on deaf ears. So I guess my question is there a stronger stance we could take as a community as a whole with the school's backing to make a change, because they're not interested in hearing what we have to say? I don't know if there's... Go ahead.
So the Thorpe school parents are writing a letter along with the school board and the superintendent of Thorpe to the governor saying, we as a family, as a community, this is how we feel. So that, I don't know if it'll have more weight than me individually calling the governor's office, but that's what one community is doing. So that letter's been going around, it's been modified, it's going to be discussed at their school board meeting. They too have to follow the law, but they're addressing it as a group, not as an individual.
So my follow-up to that would be, are you guys willing to do that?
Absolutely.
Okay.
When?
It's a start, guys.
Hi, my name's Erica. I'm pretty new to the community. My kids just started going to school here last year. So it's kind of just, everything's different. I've never even been in their school before. My question is, assuming we can't get around the mask mandate or make it a family choice and our kids are sent to school in masks, will you accept exemption forms? Because I've heard some rumors that they would segregate kids with exemptions, but my question is if we had enough kids with exemption forms, if they could form their own class, kind of thing.
We don't want mask waivers.
Well, I mean, I definitely don't want that either, but I also don't want my kid in a mask at school. So would exemptions be accepted?
So there is a mask waiver, if you ever use that word waiver. There is a mask waiver. Region 7 is Grant County, Chelan, Douglas, Okanagan, and us. And And to help with things like this, we made our own mask waiver form. It requires a parent like you who would want to have a mask waiver go to a physician and actually have a signature that there's a medical reason for not wearing a mask. So it couldn't be just, I don't want my 18-year-old to wear a mask in school. So it has to be signed by a healthcare provider, physician, TA, nurse practitioner. Then it goes to the school nurse who evaluates that, comes to the health officer, in this county happens to be me, and we work through that. We probably have, Michelle can correct me, I think we have about 10 kids this last year that had mask waivers
Yes.
in this
Are
school.
Are they just in the classroom?
So there is a form.
It depends on the individual student. We don't segregate students unless there's an actual individual education plan that requires them to have different services.
I'm just going to say something from up here.
Can you guys all hear?
Excuse me.
No.
So, if we send our children to school, at the door, they're not wearing a mask, are you going to send everybody home? Yes or no?
Just like we do with students that have temperature or any indication of having symptoms of COVID, we have to put students in a separate room for that.
So a child with no symptoms, just simply not wearing a mask, will be treated like he has symptoms and will be sent home?
Well, we can't allow students on school property, in the school buildings or on a school bus without masks unless they have an exemption or waiver.
So if we all just showed up with no masks, you're going to send everybody home?
I would really like to think that people are making sure that they understand that we're doing our job, and legally we have to require students, staff, and visitors to have masks during the school day.
So you will send everybody home that doesn't have a mask? If every kid
I did not say that right now. I am not crossing that bridge right now. Our desire is to have everyone follow the law, and so that we can have our students in school and our students. Sorry, mandate. Thank you very much.
Is there any law you're going to break at all? Anything? At all? Nothing?
My name's Cal Thompson, and it's good to see so many patriots out here. What is the science behind this mask? We know that children are the least possible way to spread this whatsoever, even amongst themselves. A lot of us have been doing research on this stuff. This mask is nothing more than a way to control us and to control the way these kids look at each other. What is the science behind this mandate? Does anybody here even know now? We've had so many variations of how you're supposed to wear this stupid mask or when you're supposed to wear it. And if one isn't good enough, maybe two is. Why don't you just put a diaper on? These kids don't spread this stuff. There's a litany of reasons why children shouldn't be wearing these masks. And I don't have any kids in school anymore, but I feel sorry for these kids that have to wear these masks all day for 8 hours. I got grandkids. They don't go here, they go down to Black Diamond, but they're faced with the same no common sense policy. And that's what it is. No common sense. We need to get back to common sense, like this country was founded on.
So there is science behind the masking. So what I would ask you, sir, is to make sure that you're looking at documents that are valid science. So I do agree with you that the science has changed. I'll give you that. The science has definitely changed. This would not be here. This masking mandate, it's not mine. This masking mandate would not be here if more of us had gotten vaccinated. So the other thing. That's true.
state be so different from the state right next to it? Just spent a lot of time in Idaho, and I gotta tell you what, coming back here, it was like everybody here, just sheep, just sheep. I mean, everybody's buying into everything. Going to Idaho, and everything was very, very normal. Can you explain how that is? Other than the color of the state?
No, that's a good point. You can look at Idaho, you can look at Washington, you can look at Texas, you can look at Florida. So things are different. All of those states have different governments, right? So who talked about micromanaging here. And our governor has been micromanaging public health. So our governor has a little different view of things than the Idaho governor. All I can say is that if you look at those states that have different approaches, there are different death rates. I agree with you. I went through Idaho not too long ago. You would not know COVID was happening. No. But I would not go to school in Idaho if it was me. So but you're right, it's different, for sure.
So like I said before, there's no science to this mask at all. There isn't any. It's different all over the country.
Did you have a question? I'm sorry.
Dr. Larson, could you please cite the exact scientific data and research that you say exists that this governor has taken an emergency stance to revoke our privileges as individuals and mandates? I would like to know them. I would like to know the number of them that this has been based upon, because in the last few evenings on television, the number of special pediatric infectious disease doctors who have been doing this for 30 years state and say that there are none, that none exist, that have been done by the CDC or the NIH. Do you have them?
Can I send those documents to Michelle this evening when I get back to work? And then Michelle can get them out to you. I think that's a great question, and I think it addresses this young man's questions too about the science. So I will do that when I go back to the office. And I'll send them to Michelle this evening.
Is that science related to the surgical mask? Because I heard that surgical and cloth mask is nothing. Anything N95 about protects, but nothing else. So this is just a shell.
I'll send you that information. And there's some data that goes along with what you're saying. So in a hospital setting, I would be wearing an N95. I have an N95 sitting down here.
You're more worried about COVID at the hospital than here?
No, because I'm more worried about giving you COVID. So
at the hospital, you're not worried about here?
So I'll send that data to Michelle. But I think your question is very valid.
But when you wear a mask all day, it's wet. It gets from your breath, it's moisture, and so it doesn't filtrate anything anyway.
I'll send that data to Michelle.
So somebody else have a question? I want to make sure each person here that wants to speak has an option to speak.
Yeah, I'd like to know, doctor, how big is this virus? How big is it? It's microscopic.
It's microscopic, yes.
So what keeps it from going under into the mask?
It would go around this mask, right? The mask that I have. Part of the, so we don't have a whole lot of tools to keep kids safe. So this last year, these people that work in this school kept these kids safe. We had parents coming in, teachers coming in that were positive for COVID. We had some kids come in that were positive from COVID that they had gotten from friends and family. But because of what the school and what the school nurses had done during the time here, we did not have secondary spread in these schools. Now, you all are bringing back a lot more kids this year. And despite what people feel about vaccines, we don't have a whole lot of extra tools, right? So masking is one tool, social distancing is one tool, hand washing is one tool, and vaccination is one.
How many kids have died in the United States since the start of COVID with no comorbidities? What's that statistic?
No comorbidities. I can tell you we've had 3 children die in Washington State.
In the United States, that's COVID.
I don't have the United States data, I'm sorry.
It's pretty small, it's less than the flu.
243.
So 243. So if that child one of those child was yours, you'd feel really bad about that.
Yes, I would, just like when all the kids.
It's not like the flu.
There's so many other things children die from. It's unfortunate that they more children die from influenza.
Please go to the microphone. We can't hear what you're saying.
Does anybody else have a question? Yes.
My name is John Crowley. I find it interesting that the governor, for the longest time, was unable to tell schools to open. And Chris Rakedahl, superintendent, also elected, said, I don't have the power to tell schools they can open. And that's up to the board. The board has the power because the board is local. The board has the ultimate say as to whether or not the school is open. Chris Rakedahl, I can't say it. The governor said, I can't say it. It was up to the board because the board serves locally. The governor has emergency powers which are this big. Chris Rakedahl's superintendent's powers are fairly limited. The fact that he is now saying I'm going to keep money from the schools is illegal, and that will be challenged. But the bigger, broader is local. You, and are you also a school board member? Are you a member of the Washington School Board Association as well? So you serve Olympia, and you also serve the people of this county. You serve the people of this school district. And these people are telling you they would like to have an opt-out. Now, Representative Jim Walsh of Aberdeen has on his Facebook page a phone call from Chris Rakedahl to the governor asking the governor to have a parent opt-out option. No. The governor says no. And the reason the governor says no is because the WEA and other unions that write the checks that basically control the governor don't want that. So the governor says, kids, even though by the way, we serve hot dogs at this school? I hope not, because 77 kids died last year from hot dogs. And the number of kids that have died of COVID did not have at least 2 comorbidities. The total number, they believe, is 3, although most states don't even keep track of it because the numbers are so small. So the fact that the governor has said masks must be in place, and then Rakedahl comes along and says he will take our money and keep our money from the school, which is illegal. He does not have the power to do that. And then ultimately, my question is, who do you serve? Do you serve Olympia or these people? I'd like an answer. Who do you serve?
Thanks for dropping in, John. I haven't seen you in a while. So.
Yes, in a while. Yeah.
Thank you so much, John.
I live here now, and this concerns me. The governor's emergency power, Chris Rakedahl has a limited amount of power because he couldn't open the schools, remember, because it was up to the school board. The school board makes the decision. There's nothing I can do. I'd love to open up the schools. I'd love for the kids to come back, but it's up to the school boards because it's all about local authority. You have local authority, and you are caving to Olympia when the science does not support that masking a child protects the child. I would ask the doctor, why don't we go through the symptoms and the occurrences of what damage is done to a child who wears a mask on his or her face for 7 or 8 hours. Very, very teeny tiny chance of sending them to the hospital and killing them. A very teeny tiny chance of having them transmitted to an adult who has been vaccinated. But what's the damage done to a child? Psychologically, that the world's a scary place and the mask is scary. And they've got a mask on their face for 7 hours a day. What's the damage done to that child? Doctor, why don't you answer that? Can we answer that? No, not we. A child, an 8-year-old with a mask on. Let's talk about the psychological damage that the child cannot see the full face of the teacher and cannot communicate fully with the child next to him and is wearing a mask on their face. Psychological or physical damage done to a child with a mask.
No physical damage.
No physical damage whatsoever.
Kids have struggled psychologically. Kids have struggled, not just elementary school kids, high school kids, middle school kids, college kids, and kids that are learning how to speak. It's difficult for them, if I was a teacher, it's difficult for them to look at me when I have a mask on. So those are the things that are impacted.
Yeah.
And again, this is not my mandate, right?
No.
So you pointed out whose mandate it was, and it's not the school board's mandate or the superintendent's mandate. It is a law. I don't know. A mandate is a law.
No,
so yes, it is. Anyway, that if we could get kids back in school without masks, without spreading disease, 18% of our cases in Washington State over the last week were kids under 19. 18%. Children's Hospital in Seattle is full, not just with kids with COVID, but kids with other diseases. We had 7 COVID patients at KBH this last week on Monday. None of those were kids because we don't do kids at KBH, but they're in the process of stopping doing elective surgeries because we don't have beds for other people. So is this? It's a tool that we have to reduce spread overall. Is there harm psychologically to kids wearing masks? Maybe, but not physical. Not physical.
Okay. Not yet.
Is a headache considered physical headache? My daughter came home 2 days last year with a headache after wearing that mask. You cannot tell me there is no physical ailment coming from this mask. She's 8 years old. She should not be experiencing migraine-type headaches from a 7-hour day at school. So you cannot tell me there is no physical harm.
I had the dentist say my daughter, because it pulls on their ears and pulls their jaw forward, that they are seeing a considerable number of issues with masks.
It's called mask time.
And also when I had COVID twice, my daughter, my granddaughter, my husband, my mother were all around me the whole time. Not one got COVID. I'm just curious why.
I can't tell you what was circulating at the time that you got COVID, but the virus that's circulating currently is the R0, which is the reproductive number of that virus, is 2.1 in Eastern Washington, which means that for every one person that's infected, 2 people, they give that to 2 other people. And maybe you had a different variant at the time that you got disease. It may be that you spent less time around your family. The secondary spread of disease in families, we're much more likely to give it to our spouse than we are to our kids because we can stay away from them. But I can't tell you exactly what happened.
Well, my 8-year-old grandma.
My name's Darcy Millard. My daughter will be starting kindergarten. She's my only kid, so I don't have any experience with the school or anything, but you had mentioned earlier kids testing positive last year. Did the school test them? Or were they, how did you know they were positive?
Some were tested in the school, some were tested at their physician's office, some were tested in the ER, some were tested at urgent care.
Okay, I did the kindergarten registration. There was a form about having your kid tested. I did not fill that out. I do not want my kid being tested without me knowing. That will not happen, correct? If I have not given consent. Okay. Can you go through what school is going to be like with these kids wearing masks? Are they going to get efficient breaks? I think recess, there was none, right? They did not have to wear it during recess. What's lunch going to look like? I want my kid to be able to have lots of breaks. You talked about speech also. My daughter was in the pre-K system. She had a speech delay. That's very important to me that she stays up on that. I don't want her falling behind. She was born 10 weeks early, and she was in the hospital for a long time, so I understand hospitals and kids get sick and everything. But at the same time, I don't want my child growing up being afraid of other people, other children he can't be around. I heard from another mom last year that school staff was going around with a ruler, and if kids were not 6 feet apart, they were tapping them with a ruler. Is that going to happen again? that psychologically puts something in a kid if that happens. And she pulled her kids out because they were miserable.
First of all, I want to say it is emotional as a parent, so thank you for sharing, because I know how hard it is. I know how hard this whole situation is for everybody with masks, and if it was up to me, it would all go away. You're just accustomed to kids coming here without masking and just living normal lives. I do have concerns too about long-term impact of masking. I think it's so early in the research yet that there's not a lot of longitudinal research on it, which I think parents deserve answers to. And that would be one thing that I would like to know from Inslee is, what are the metrics to say when students can come back to the classroom unmasked? Because I think families deserve to know that. They deserve to have information on that. I also think from an early childhood standpoint, it is so difficult for our youngest kids to come into the building with strangers, into a system that's strange for them, and then be able to talk and communicate through a mask. As we know, most body language, how many of you raise babies, children? How do they communicate with you when they're infants? Facial expressions, right? So we know that, and we don't have the longitudinal data to say, what does it mean for kids that are in school age with masking? So these are all legitimate concerns, and I think as parents, you deserve answers. And I think that's something that we as a community can work to find answers to, and demand answers. I think the other thing is, with the masking, is it's really difficult for kids, especially early primary, is trying to figure out how to read. You're doing language immersion, right? And speech, my concern is too, a lot of the students. What are the speech disabilities that we won't know until after masking, because they haven't been able to see the language in the mouth forming words and making sentences. So these are all legitimate concerns that we as educators have. We as a community should have, and should have some answers to. So I recess as much outdoor time as we can get. That's what we're gunning for. Our admin team will meet tomorrow about, so what can we do to give kids a sense of relief from the mask?
Is there a possibility of having class outside once in a while to give them more of a break? If the weather's nice, obviously winter, that's not going to happen. Also with the science, I know you're going to provide that information. Why can't we use more local? Are we using national science? Are we using state science? We're a small local community. Why can't we use local? My child's been at Little Explorers without a mask on. As far as I know, no child has been hospitalized with COVID from there. No parent has. So why are we not using our own data for that?
I can give you local data, but we don't have any local scientists looking at the long-term effects of masking and those type of things. I can give you the data, and I'll get that to Michelle too.
Well, the spread.
In regards to the spread, things are different. So if the governor did not have a mask mandate, so all of you are asking for local control. That's what you want. You want your school board to be able to make decisions. That's how public health has been in Washington State as long as I have been a health officer, and longer than that. It's considered home rule. The governor, as people have pointed out, has taken his emergency powers and made a mandate. That goes over the top of my head. So what I think is going to happen, here's my prediction, is if any of you are watching the Delta variant, and you look at India or you look at England, the numbers went way up, and then they dropped like a stone. Now, we've got about 4 more weeks of increasing numbers. I told our new CWU president today, Jim Wolpert, they have a mask mandate. Central made a mask mandate on their own. They put September 15th as their end to the mask mandate, unless things are not going well. But they feel like the numbers are going to go up and they're going to come down. If you're talking to the governor, whoever was writing letters to the governor, you should put in there the natural history of the Delta variant, which is what we're seeing, about 97% in Washington State. It should go up and then it should come back down. Much more infectious, but it's burning through the people that are susceptible to that variant, and I would expect it to come down. So that's what I would put in your, whoever's writing the group letter to the governor, you should talk about that, because that's what we've seen in India and what we've seen in England as well.
husband's a businessman. I tried to contact the governor, I don't know, for probably 8 months regarding businesses that have been closed and an issue that I personally had. And you cannot get a hold of the governor. You cannot, there's not even a phone number for the governor's secretary, so evidently he doesn't have a secretary, but you can't get a hold of him. So I don't want to write empty letters that get dumped in a, oh, there's that annoying Mary Fauché letterbox. You know, I think we need to have more activism, like people showing up over there. So that's my one part. Now my second part is I participated in helping the outdoor preschools become licensed in the state of Washington, and I did it through Roslyn Outdoor School, and participated in that and saw how it went. And all you have to do in order to have outdoor school is you have to have bathrooms. We have bathrooms. Why don't we do outdoor school until the masks are done? And I am dead serious. Outdoor preschool, 3 years old to 6 years old, they hike all winter long. They wear their boots that are good to 30 below. They carry their, is it 9 essentials? Help me out, I'm old now. They carry their own water, they carry their extra pair of wool socks, they carry their own backpack, they carry everything that they need. If their feet get wet, you know what they learn? Oh, I don't want to do that next week. And it helps, but it's outdoors. Can we do that until the masks are lifted? We have the facilities. Thank you.
So I'm sorry, I don't know your name, but I'm going to assume that you're the one that's responsible for writing the letter.
I will take responsibility.
So Salvador Salazar is the governor. So where'd you go? I agree. It's hard to get a hold of the governor. And for the last 18 months, I've hammered on people I know at the state over lots of things, including masks, including vaccine mandates, all of those things. But Salvador Salazar, I'll send his contact to Michelle, is the governor's Eastern Washington contact, and he is responsive. So I'll send that contact to Michelle.
Thank you.
To go along with that, can I just ask really quick, if we put something together like that before, would we have your backing that you would sign it as well? Given that you get a chance to read it all.
Yeah, I'd like to read the letter, but I think it'd be powerful as a community to write the letter. And some of these questions that you have that we can't answer, you should know. You should be known. This information should be known to families in the community. I don't have these answers that you're seeking, and it's frustrating not to have answers to some things that are a mandate that we are bound to. I too have asked. I know Gar's actually met with Mr. Inslee, who was busy and didn't give him much time to talk. We wrote lots of letters last year asking for local control and local decision making. Dr. Larson was great jumping on that bandwagon with us to allow one of our counties, Upper Kittitas County was the only school district, the only group of schools that came back with all of their schools in the district in the state of Washington last year. And it was because we had local control and we could push on that system. When it's taken away, it doesn't feel very good. And that's where we're at right now as a community. For some families who've reached out to me, they want the masks in place. They're very worried about the masks coming off. We're a public school. We serve all students that walk through our doors. And so as a community, what can you do as a community to ask the governor answers to these questions? How many letters? How many trips to Olympia? That is your right to do that. Yes.
Okay, so on that note, sorry, this is weird for me. I can talk on Instagram all day long, but I get in front of real people and I'm freaking out. But that word, I heard that word in this, I wasn't going to go there yet, but I heard you say ask. Now it's important to remember that the government is ruled by us. We don't ask them. We tell them what we want as the people. And that's what we are asking you guys to band together with us to do. And I have the Constitution with me. And I have the 9th Amendment. Everyone likes to talk about the 2nd Amendment and all that, okay, whatever. I'm not here to debate masks, vaccines, or the 9th Amendment. It was The enumeration in the Constitution of certain rights shall not be construed to deny or disparage others retained by the people. Now, in layman's terms, that means the rights in this are not limited to what they wrote down. We hold those rights, and we will continue to fight for our rights, whatever it is. That includes health freedom. And right now, we're at a point where our government is trying to tell us and these schools that if you don't obey, they're going to take away your funding, they're going to take away your jobs, they're going to take away your money, or whatever it is, your livelihoods. We can't let them do that. We have to fight. And I appreciate people who wear masks and get the jab, or that's their right to choose. But we cannot let our government tell us what we get to do with our bodies, or have to do with our bodies. And we need you to get together with us and fight this, please.
Yeah.
I have two students that go to the elementary school, and one's okay with not coming back possibly because of not wanting to mask, and the other misses people and wants to be around them. And part of my question was answered already about if we were to write a letter and come up with something. I don't know if there's a certain number of people supporting it that it's going to take for you guys to kind of hop on board, or what that is. So first question would be, is there a certain amount of people, or are you in support of that no matter what?
I don't think there's a number. We did letter writing last year, a lot of it, and never received a response.
Okay.
So I say, I don't know if letter writing is effective. It's a start. I think Mary must have, Olympia, go to Oli, is that what you said?
The problem is there's lobbyists, and how you speak to our legislatures is you hire the lobbyist. That's the problem. As individuals, we don't get to speak. You have to hire the lobbyist. And then the lobbyist gets in front of the legislature. And it's a nightmare. And that is the truth. For us to drive there, it's an 8-hour day, and you wouldn't even get in front of the people that you need to get in front of without hiring a lobbyist.
Right, so I guess that kind of goes along with too, is that's why there's a board, is what I would think, is you're there to represent the community. So us going one by one into a giant group of people, they're not going to go, oh, there was 40 more people there from Cle Elum this week, we should probably pay attention. That's why we have people above us there to support us and represent us. So that's my one thing. And my two other things were more directed towards you. You made a comment that if more people got vaccinated, we wouldn't be wearing masks. So why is everyone that's vaccinated wearing a mask? That makes zero sense. And it kind of seems like you're blaming people for making a personal health choice to make this worse, when I've seen science that said otherwise. And also, we're at a community meeting asking questions about the science behind something that you're forcing our children to do, and you don't even have the numbers to support it. You're doing a circle back mentality that we have heard so many times, and we're frustrated and we want answers. And nobody can give us those numbers, but you're gonna go home and get an email. But you come to a meeting where people are here pissed about their kids, and you can't give us a straightforward answer.
Multiple parts of that question. So the first is this young lady asking to give her the exact data. So I didn't come with the exact data, and I want to say, well, here's some data, and then she would say, well, that's not exactly correct. So I felt that, to be totally honest, I would give her the data. So the masking, and so I'm vaccinated, and I don't really care whether you're vaccinated or not, but I'm wearing a mask in the school because it's a rule in school public buildings that when there are children present, and there are some children present here, that masks are required. So that's why I'm wearing a mask here. So masking in general for somebody like me that is fully vaccinated. So I'm 65 years old, so I'm in a high-risk category. I've had a cancer, I'm in a high-risk category. The Delta variant is very infectious. So
that's what they
said about the first one.
Well, this is way more infectious than the first one. And the next one may or may not be as infectious, but Delta is very infectious. And I would rather not, if I was in a room like this that wasn't a school, and all of you people I knew were vaccinated, and you were over at my house, I would not be wearing a mask.
Would it be different if you were eating food?
Huh?
Would it be different if you were eating food? Would there be less risk if we were all just sitting here eating food in a restaurant?
No. Okay, restaurants are, so, I mean, let me say what I'm saying, that's okay.
I'm just checking.
So,
we sit at restaurants and nobody has masks on.
So there is spread from people, if I'm in a room with 100 people that are not vaccinated, my risk of getting COVID from you, if you were not vaccinated, is high enough that I'm willing to wear it. So there's what the science is.
Actually, there's science out there that says we get COVID from those that are vaccinated.
Yeah, that's fine.
Actually, it is. My brother just got COVID from a fully vaccinated.
So we have one more question, and then we are at our time. So thank you, Dr. Larson. Do you have a question? Yeah.
Hello, I'm Cassie. My first question is for you, Dr. Larson. What would happen specifically to you if you went against the mandate and told the schools or school boards that they could choose if they want to provide opt-out options for parents? Okay, so there's your answer. Okay, so there's your answer from him. Now you guys, if you went against him and said, you know what, we're going to stand together and we're going to offer our parents, even if you got a tally of how many parents wanted the opt-out versus how many that are like, we just want the masks. If you have a majority of the people wanting to not wear masks, if you gave them that choice, what would happen to you?
Our school district would lose all of our funding, and we would no longer have enough money to have our teachers and to have school.
You're going to have no teachers. All the bluff. All the bluff.
I agree.
All the bluff. All the bluff.
Would you all lose your jobs then?
Probably lose our jobs, but
okay.
I mean, it's
So
beyond.
what we're at right now is people who are afraid to lose their job, which I get. It's got to be a tough position to be in. I totally get it. But we're at a point now where if you're going to talk the talk, you got to walk the walk. And we have people who are afraid of losing their jobs that are going to put that ahead of the safety
So let me correct
and
you,
the best
Cassie,
interests
real
of
quick.
the children.
So we have two attorneys that work for us on this. So first of all, when you look at L&I has to provide safe working environment. So we are at litigation with L&I, not just teachers, anybody. So if a student got sick with COVID and we went against it, the district would be sued. The district would be sued as a district. Already we would lose all federal and state funding, regardless of if we lose our jobs or not. That's the last thing, right? It's the setting up the school district for the future. So you would lose all funding, we'd go through litigation, we wouldn't be carried by risk management, and that includes anybody on our school property that opens for litigation. So legally, that's what happens.
So can you get sued if a child gets sick with anything, or just you're saying COVID?
What I'm saying is COVID because it's a requirement by the school districts to follow the mandate of the governor, and if you violate that, then you lose all your funding, right? You also lose any opportunity to fight any litigation if anyone gets sick of COVID, period. The district is no longer protected by any legal counsel.
And did you guys have health mandates before COVID?
We followed all the health mandates before COVID.
I know from personal experience that's not true, so I'm just saying for people to pay attention to the journey of people, the path of who's saying what they can and can't do, and what is at the best interest of those people, because that's essentially what's going to help us change things.
Great, thank you. All right, thank you everyone. Are there any closing comments that you have for the board?
So, I always appreciate people coming, I appreciate listening, I appreciate the questions that people have. I'm going to talk to this young lady and get her the Thorpe Schools email that talks about their letter. I can't tell you whether it's important. I can tell you that I'm not worried about losing my job. I'd much rather go back to the job that I had before. Some of these people here know me and know me as a physician, so I'd much rather go back to that. But my job is to do what is best for the community as a whole. I'm fighting for all of you, but there are certain things that I can't do. But worried about losing my job is not one of them. So please come see me after you're done.
Can I ask one more question just to add on the research that you're going to send over? I'll be really quick. I'm just curious if they've done any research on specifically kids wearing masks, because the mask research that I've seen is when it's properly worn and you're fitted for it. My experiences and my own kids and kids in the community, they are not doing that. So I'm just curious if there's any legitimate research behind that, because I understand if you're properly fitted and it's worn correctly 100% of the time and the people you're around is worn 100% of the time, it might be something, but I just want to make sure it's valid research for what we're fighting against.
Okay. Ireland did an extensive study, so yeah.
There's one in preprint right now.
We want to thank you all for coming. I know we didn't answer all your questions, but the object wasn't to answer all your questions because many of them obviously we don't have. But our goal is to get our kids back into the classroom this fall so they can be healthy and safe and supported. So I hope we can find a way to work together as a community. Thank you, Dr. Larson. Thank you, Barb, and thank you.